early August we were contacted by the Lincolnshire Care Association and later LCC to say that the NHS were rolling out antibody testing for all social care staff. And the reason for that is because they want to understand just how many people have been affected, because we know that people can be asymptomatic. Some people may not have been that unwell, that they won't have been tested, and in the early days testing wasn't widely available, so at the moment nobody knows just how widespread COVID is.
What they're testing for is the sign of antibodies. So basically when somebody's infected with a virus or a bacteria or anything, the immune response is to basically try and attack that invader. And what they use to attack the virus or the invader, if you like, is antibodies. So they're looking for those in the blood. What the test involves, it's like taking a normal blood test. So when I went for mine, you just attend to the pathology lab at the hospital. They will put the tourniquet on as they would normally do to take a blood test. Just take a small amount of blood and that's it, you're done.
For the antibody testing, I followed the directions on our Exchange It on Zone Standard, emailed over to the email address. I got quite a quick response actually, and they just simply asked where I was able to go, what times I was able to go. I told them which hospitals, which times I was available, and then my appointment was booked. I had the test on Monday, results came back a couple of days later, quite a quick turnaround. My result was negative.
My result was that I was positive for antibodies, which suggests that at some point I have had COVID. I have no awareness that I've had COVID, I've not been unwell.
If antibodies are detected in your blood, what that tells us is that you have had the virus at some point in the past. What it doesn't tell us is how immune you are to the virus. So if a result is positive, this doesn't change any of the control measures that we have in place at the moment. So PPE remains the same, social distancing guidance, it all remains the same.
So we'd really like to encourage all staff, if at all possible, to go and have an antibody test. It's a really easy process. Certainly at Lincoln, the parking is free. It takes 5-10 minutes, no more than that. So it's not a big job. If everyone would go and do it, the more people that have their antibody tests, the more we understand COVID. Hopefully that will mean that we can move forward in easing restrictions as a society sooner, but also as an organisation. It will help us to understand if all of the measures we are putting in place are effective, if we have staff that would find that they have got antibodies, and the individuals who have been protected from that will know that the masks and everything else that we've got in place are actually working. So please go and have your antibody test as soon as you can.